Welcome to the 3030 Health Podcast. The following discussion is for education and entertainment. It is not intended to diagnose or treat disease. Please do not apply any of this information without first discussing it with your doctor. Here is your host, Dr. Ruiz.
Hello everyone, today's episode is about cancer. Our guest today is Dr. Nasha Winters. She is the best-selling author, lecturer, and the primary consultant of Optimal Terrain. She has over 25 years of experience in the healthcare industry and is a thought leader in personalized precision medicine. Dr. Nasha works to educate clients, doctors, and researchers worldwide on how to apply integrative oncology philosophically and therapeutically. She graduated from my alma mater, the Southwest College of Naturopathic Medicine, and is board certified and licensed in acupuncture and oriental medicine from the International Institute of Chinese Medicine in Albuquerque. She is also a fellow of the American Board of Naturopathic Oncology. In addition to consulting, Dr. Winters is available for speaking engagements and has a TerrainTM training program launching for both doctors and patients in the near future. Thank you for your continued support. If you enjoyed the podcast, please leave a review on iTunes. It will help get our message out to more people. And don't forget to submit your questions for future podcasts at 3030strong.com. I hope you enjoyed the show. Hello everyone, I'm super excited for today's show. I have Dr. Winters. She's a FABNO certified naturopath. And as you might know if you follow my show, I came to this profession because of cancer. And cancer affects so many people. And this is going to be a little personal for me. I'm going to be learning as much about cancer as you are. And most importantly, I want everyone to know that there are, I don't even want to say alternatives to cancer. It's complementary therapies for cancer. Before we get into this mess, Dr. Winters, how are you doing?
I am so good, and I love being in your energy field, man. You are such a positive light.
Oh, thank you so much. So, how funny is it that, we are in the same profession? Me as a student, last year, and now a doctor. You wake up one day and then people call you doctor. It's pretty cool. And we knew about each other. We have a lot of mutual friends, Dr. Daniel Rubin, Dr. Paul Mittman, Dr. Alan Christensen, and we never spoke up until this past, when was it, at AHS?
Yeah, I remember, yeah. It's crazy. It's like, and I've been stalking you a little bit, so it's fun.
But for people that out there, that don't know your story, Dr. Winters, what is your hero story?
Oh man, gosh, I know you were going to ask me this question. I've been really thinking about it because, to me, a lot of people want to hear my cancer story. That's what seems to draw people in, and that's sort of like, I don't know. It's like it was the thing that happened. But the real part of my story is that my entire sort of existence was sort of told what I couldn't do. The world around me sort of said, you will never be able to go to college. So you just have to look at going to maybe go and get like a secretarial degree or something like that. Or, hey, you're never going to make, the volleyball team. You're never going to make the cheerleading squad. You're never like all the, what you can't do, what you won't be. It seems to have been a common theme throughout my life, leading up to the eventual quote unquote big C sort of crescendo story of all of this. And what my mom, my friends, my family, the people who are closest to me will tell you, it's almost like whenever you tell me it can't be done, some little switch inside of me is just like, what are you talking about? Are you kidding me? You just completely put a big double dog dare on me, and I'm gonna find a way to do this. And so I think in that place, my life story, my life passion, my hero's journey is I have been the advocate for myself as the underdog since the beginning of my entry into this world. And now as a clinician, and someone who's very fascinated and passionate about healthcare and changing the healthcare system, I recognize that I am a sometimes lone voice, sometimes very unpopular voice, up against. In fact, I was just on a Facebook forum being ripped to shreds by a woman who is a she's like makes chemicals for chemical companies and is talking about how I'm not a real doctor. I'm so used to being in that place that it does not even faze me anymore. And so I think the hero's journey of where this comes through is at 19 years old. Well, actually, had just turned 20, but I'd spent a year trying to figure out what was going on with me. I was told that I could not and would not survive, and I had a matter of months. And that even with treatment, it was like that was going to expedite the process because I was so far gone and I was in end stage organ failure. So treatment would have just pushed me over the edge at that point. And that was, again, one of those moments in life that said, it can't be done, say goodbye. And what that did for me is clicked on this little internal switch that frankly, that switch that I told you about in the beginning that got me fired up and was such my amazing way of being in this world. There were a couple of years there before my terminal diagnosis that I had given up. I did give up on myself. I did give up on being on this planet. And in fact, really considered and even had a few very trial and error moments with that. And so for me, the cancer diagnosis was literally can I curse here?
Oh,
Can I say
totally.
my grandma, this will crack it. My very Methodist Kansas grandma always said, shit or get off the pot. That was literally my shit or get off the pot moment of, do I stay here? Do I go? And it invoked such a deep fire within me that I've never gone back to that place. I don't even know what that conscious place looks like anymore of wanting to ever give up. And so that is what has led me into being that advocate for so many other patients that have frankly been sent out to pasture that have been told there is no opportunity for you. And I somehow seem to find or magnetize those types of patients into my being, into my circle. And I get to see and collect miracle stories and miracle connections, even people having miracle deaths in the type of work I do today. That is just, it's an honor and a joy.
So what was your diagnosis?
My diagnosis was ovarian cancer, stage 4.
Wow.
Mm-hmm. Yeah, exactly.
So at that moment, you're 20 years old. Where in your education were you?
Oh gosh, I was into my second year of college. I was pre-med. I was hell bent on being a doctor. I was like I had my eye on the ball for going to Baylor Medical School. That was where I wanted to go.
Why Texas?
Why? Because, well, honestly, it was a high school boyfriend is what wanted me to go. But it was like it was a place. It was like that was always for me. I always had kind of a goal or intention. I still have that today. It's like when I set my mind to something, it's an easier place for me to get to if I can see it. But yeah, Texas, otherwise, it's hilarious to imagine myself there now. But yeah, that's where I was thinking of moving in that direction. And I was so sick, and I was taking a huge load of, double major at that time, biology and chemistry. I was working full time. I was first person in my family to ever go to college. I was paying for all of my education. I was taking tons of Pell Grants and lots of student loans. There were times, people know my story. I lived in a barn. I lived in a VW bus. I lived in a TP for years. I did whatever I could to succeed, to be, to get to reach my dream. And so at the time of my diagnosis, and my subsequent go home, there's nothing we can do for you, I also was working in the library as one of my work study jobs to pay for college. And I would literally lock myself in and sleep there at night and peruse all the medical books I could find to understand the chemistry, the biology, the physiology, to understand the mechanism of action of what was happening in my body. This is way before, this is 1991, for crying out loud, way before Dr. Google, right? Way before internet. So it was literally the Dewey Decimal System. You probably don't even know what that is.
I do know.
But this is where I just poured through, and I started running across literature and information at that time about this crazy guy, Dr. Otto Warburg. I started back in 91 about these concepts that made more sense to me, like Beauchamp's theory of of health versus pastures, and the Warburg concepts versus the Crick and Watson concepts, my brain kept pulling me into these old, outdated, buried ideologies that just resonated with me. And frankly, I think they are why I'm still alive here today.
And we're gonna touch on Warburg and the Warburg phenomenon and all of that. Were you at a dark place where you started making a bucket list?
Oh, heck. Well, my dark place, what happened to me in the dark place is I just gave up. That's where I was for a moment in there. And then what happened is after I had, well, what actually happened is when they said, you absolutely can't do this, it fired something up in me, and it fired up anger. Okay. Anger in Chinese medicine, as you recall, is the will to become. So it kind of was a catalyst. It sparked something inside of me to say, okay, what next? So my bucket list did just start to emerge, and it wasn't like I was creating a list. I was just doing it. So, I was traveling the world. I spent 7 months backpacking around in the midst of, I sold every single thing I had. My then boyfriend was selling my CDs and sending me little tiny wires of money, like $30 here and there, just so I could keep going, sleeping in parks all over Europe, traveling around, finding healers, in all parts of the world, from curanderos to shamans to, old Ayurvedic practitioners to, old nature curists, homeopaths, you name it. I just started running across these amazing people and healers for this 7-month backpacking journey, because I never had left basically Kansas or my college town of Durango, Colorado at that time. Not much travel. And so for me, my bucket list was sort of like, get out and inhale the world, absorb it, see it all, meet everyone you can. You're fascinated with health and healing. And if you can't survive this, at least learn everything you can until then. Try and figure out the why.
And when did they give you the big good news that you are done?
So I haven't had that big good news.
Really?
Yeah. So I am 26 years out as of October 21st. Okay. And I've not done Western medicine for this. And so I still, at least the last scan was about 10 years ago. Now I just monitor more through labs and liquid biopsies and other things. Nothing is brewing, but nothing has been removed. And I still showed in the past, still showed the tumor on my right ovary, peritoneal implants, carcinomatosis, some loculated ascites patches, and some lesions on my liver are still there. So I'm that person who is living, not just living, thriving well with cancer in my body. We are simpatico. We are, on this journey together, because it is me.
That's mind blowing.
It is mind blowing, right?
Well, in what's funny is that we have cancer right now. Your listeners, everyone, it's just about, is your immune system detecting it and eradicating it.
Exactly. And it's the health of your mitochondria at the root of all of that. So your thoughts, what fuel you put into your body, what toxicant exposures, even what toxic emotional exposures you're putting yourself in front of, are weakening our mitochondria, which then set us up for damaged DNA, which then lead to chronic illness and cancer. We've been looking at the DNA, the gene, as the problem, and we need to back it up a notch. And as naturopaths, we're the best at getting to the root, right? And so even getting down to that mitochondrial organelle has been so part and parcel of our own, theory, our own philosophy, that it's just beautiful to me that we're like, no, go deeper, go a little bit deeper. And that's ultimately where we go.
And when did you decide to just say, you know what, I'm going to be a doctor? And then you found naturopathic medicine.
Well, it's funny because in the midst of my late night all-nighters in the library through 1991, I stumbled across, I can remember sitting there and I stumbled across something in the back of a book that talked about naturopathic medicine in like one of these, it was in some like medical journal or something. And it was sort of like, oh, they have a vital, it just kind of mentioned it, just quickly brushed over it. Again, like my brain that was holding on to these other thoughts and theories just honed in on that. And I started exploring like, what is this thing? And I started looking everything I could about naturopathic medicine, and found out about Bastyr and National, because that was it. Then. Yeah. That was a long dang time ago, back in the olden days. And when I was researching, I stumbled upon the fact that, talk about a miracle, there was a naturopathic doctor in my tiny, tiny town of Durango, Colorado that had graduated from National College. And I immediately, this poor woman, began stalking her and mentoring with her, and eventually years and years later took over her practice. And, it's like the rest is history, but it was divine intervention in my mind that this person happened to live here, and she just became a sounding board. She wasn't even my doctor at that time, but she became a sounding board, an inspiration, a motivator, and someone who just started planting little seeds of what could be in my mind of where medicine really could go. And I reconstructed my degree to leave biology and chemistry to do biology and psychology, and basically created a self-constructed major of psychoneuroimmunology because I was well versed in the trauma history that led me to my diagnosis. I was the one walking the walk of it. And this is early times, and we just started hearing from people like Candace Pert and that whole psychoneuroimmunology group there were just starting to get their feet in the water. I was on fire with this.
And so then you go to school and to become a naturopathic medicine, and then you tell your advisors, I want to be a cancer naturopath.
No, you know what cracks me up? It gets crazier because I didn't even tell. This is where the story is really weird. No one could know what was happening with me outside of a handful of very close confidants, because everyone either A, had already written me off for dead, B, were horrified that I wasn't getting conventional therapy, C, just couldn't handle I'm a college kid. Who wants to hang out with that? I wanted to be normal. Okay. What 22-year-old man is like, I'm going to hang out with this dying 19-year-old who's now my husband all these years later, but he stuck around for the long haul. But I kept my one professor up at the college, and clearly my medical, one of my doctors here in Durango, was pretty much it. And when I started naturopathic school, I did not tell them. I was afraid they wouldn't let me in because I was still very sick when I applied to naturopathic school. And there was no way I was going to tell people that was happening, because I thought that would keep me from getting in because of everybody else's reaction. And then even in school, I had two doctors that I trusted is my student doctors that were under following HIPAA, and then a handful of very close classmates. That's all that knew. And so it was hidden. And I actually promised myself when I started naturopathic school that I would never work with cancer. I didn't want it anywhere in my field of existence because you got to remember, I was trying to run like hell from it still. I was still only a few years into this process and still bumping around in the dark, trying to figure out what was working and not working for me, and just trying to keep my head above water.
So I was talking to Dr. Mittman, the president of the Southwest College of Naturopathic Medicine, and we were having a conversation. He says that back, when he was going through school and people said, oh, I want to be a naturopathic medicine doctor that specializes in cancer, people would be like, never. That would never happen. So I thought that was your reality, that you went in there and I was like, I'm going to be the naturopathic doctor that, and then they said no again.
But know what happened? I said no, but the universe said yes. Right? And my very first week in practice, the very first week, a gentleman comes in a wheelchair for pain management, because I was dual trained acupuncture as well, who's just wanting pain management. I don't know anything about his story yet, except for I noticed right away that his head looks very different. It's very pushed out. His eye is smushed down. He's wobbled over in the chair. There's a very odd smell coming off of him. He's unable to talk. He's sitting in a diaper. Okay. And I'm like, what is I'm a baby green doctor? Can you imagine your first week, back in June, July? Come to find out, he's got a glioblastoma. He's already several months into it, and they already told him he'd be dead within a few weeks because his ventricles had already closed on the CT scan. So he was no longer pumping cerebral spinal fluid. So they were coming to me for end of life care and pain management because the morphine, the narcotics weren't working. And because I was working in a neurology office, I was doing a lot of pain management. And what the neurologist would say in town is, I get all the train wrecks, and if I can't help them, I give them to you. And so that's what was happening. And suddenly I'm sitting in front of my very first terminal cancer patient and thinking, okay, I'm going to help him, be comfortable as he dies. Guillermo, he lived another 18 months.
Wow.
Which was already, that right there If people know the GBM world, that is not normal. That's not even the inline if you do all the conventional therapies. Now, he refused any conventional therapy. It's actually probably partially why he stayed along, because those therapies aren't very helpful. But we got him because of those textbooks I was pouring through, years later or years earlier. The only thing I knew to do for him for his seizures was the ketogenic diet. And then, of course, acupuncture, and I was doing a lot of homeopathy, and we were doing a lot of immunology stuff because he came from a lot of trauma. So we were working on that. It was a miracle. And suddenly, because it was such a small town, everybody seemed to come out of the woodwork that had cancer that wanted to work with me. And there we are, that was in 2000. And here we are in 2017. And finally in 2012, I had to close my practice down to anybody beyond the oncology patient, because I simply couldn't keep up with keeping learning and also addressing this. So like I said, I was saying no, and the universe was like, no. Now we're going to turn the tables on you.
Well, it was about time, to get some payback, I guess. So yeah, and within naturopathic medicine, now we're talking shop. With naturopathic medicine, there's two camps, that the camp that says, oh, specialize, because then we can get better at what we do. And then the other camp that says, do not specialize because you give up, things. I'm of the camp that I say that we should specialize to give the best that we can do for our patients. And it's funny, of the specialties, probably the most relevant and the fastest growing field within naturopathic medicine is naturopathic oncology.
Yeah, and it's funny because I being in a small town, away from any big cities, away from any big regulators, okay, we were primary care in our community, and I saw everything. I was everyone's family doctor. For 10 years, I was the only endocrinologist in the Four Corners. The MDs would send their endocrinology cases to me. I worked with all of the HIV patients. I worked with all of the autoimmune patients. I worked with all the diabetes patients because no one else could do it in our community. So I had my trial by fire of just simply being a primary country doc. And then to me, that was the best fodder and the best education for me to be able to be effective with patients with cancer, because you have to use every single thing you have ever learned in medicine to work with this population. And so specializing is one thing, but having relevant, vast, clinical, terrain-centric, nature cure-centric knowledge is also critical to be very successful with oncology patients, because you are having to put on your thinking cap in ways that you can't even imagine.
and what's insane is that within cancer, what happens if it's an endocrine type of cancer? What happens if it's like ovarian or breast cancer? There's there are, maybe there are, but subspecialties of like gynecological cancer and neurological cancers, and so now you're like specializing within a specialization.
It is. Yeah.
So and the reason cancer care in naturopathic medicine is so it's such a growing field. It's because of the complement and all of the things that we can do in order to maximize care.
Exactly. And for me, what's been so easy about this is that I don't treat cancer. I never have, right? And so I treat people, and I treat the patterns they're coming into me with. And to me, I could not have learned that in conventional medical school. That would not have happened. And in the conversations and the people I consult with now in the conventional oncology community, they're like, they want to know, they think I somehow like have, I don't know, they just don't understand my brain in a complimentary way. They're just like, we love to talk to you, because they had that funnel visioned training that took them down to the tumor cell, and they forgot everything else that's wrapped around it. But we didn't get to that tumor and that tumor cell without problems in the field around it. And so that's where I groove out, is I back it up to the whole terrain, and I don't care what the diagnosis or the type or the tissue type, and even that kind of kooky off the wall medical doctor billionaire out of LA said we should stop calling cancer like breast cancer, ovarian cancer. He's really even talking about now calling them, the molecular fingerprints that they are, the genetics that they are. So at least the conversation is starting to trickle into mainstream to say, wow, we should look at this more as patterns versus tissue types, because I see tons of patients that I'll get their tumor assays and they may have breast cancer, but their tumor assays and their molecular profile looks just like a colorectal cancer patient, right? Or a pancreatic might look like ovarian, or I'm giving examples of that, but it's like we just have to let go of the attachment of, oh, I have breast cancer. What do you do for that? Okay, I don't really care about the breast cancer. What's going on in the rest of you? What's happening in the rest of your terrain that got you sitting across from me having this conversation?
And that's, treat the whole person.
Yeah.
Instead of treating, the individual parts of the person. And it's really easy to say it, like to verbalize that, treat the whole person. But in reality, the problem is that the systems that we have created are compartments of that person. And and I'm going to give a quick example. Let's say you have shoulder pain. What's the prescription for shoulder pain? And then you have a thyroid disorder. What's the prescription for the thyroid? And we gravitate towards that, and it's hard to step back, take a couple of steps back, and say, okay, what's going on with the whole person, and then address that, and then dive in.
Right. It's very seductive, right? That little one cause, one treatment. That's why Western medicine is so excited right now about the targeted therapy research going on in cancer, is because like, oh, we can find this one gene or this one molecular, targeted spot, and we have a drug for that. But holy cow, tumors and cancer itself is very heterogeneous. It's got a lot of working parts happening throughout the whole body, but even throughout the whole tumor. You could have like 6 different types of cancer in one tumor. And so it's like playing that ultimate whack-a-mole game, trying to go after one target, when it's like, if you actually hit that target, you actually wake up all the others. And so that's this place where it's really difficult. I just was at an incredible conference at Hopkins a couple weeks ago, and this doctor said, if we keep going at, this is an MD oncologist, mind you, and he's at Memorial Sloan Kettering, and he said, if we keep trying to do the target to the protein to the targeted treatment, because if we keep going that 1-to-1 ratio approach, because it's going to be 200 years before we get anywhere. And, I'm sitting there in a group of 200, 300 doctors going, like, this room is like waking up. And these are conventional, like I'm amidst giants in the field of research and conventional interventions for cancer. And I'm just like having such a moment of gratitude to realize they are waking up to understand that you have to go and take care of the terrain.
And we've seen this happen, like, for example, with bacterial infections. If we focus on a single mechanism of action, the bacteria is reproducing so fast, one mutation happens, and then now that bacteria is resistant to that single mechanism of action.
Exactly. You've seen it so perfectly in the work you've done. They're very similar personalities, aren't they?
Yeah, and I think the common denominator is that cancer is reproducing or replicating fast, and so is so are bacteria. So because of that replication, you have more chances for a mutation, and you only need just one bacteria to be the mutant. Same with cancer. You can eradicate 99% of the cancer, but if one cell resisted the treatment, now that cell is gonna basically clone itself, and now the treatment doesn't work.
Yeah, and that's why I think when you said that the fastest growing field in naturopathic medicine is really in the field of oncology, it's because our colleagues are saying, we need help here, guys. You see this in a very different way than we do, and we think it can be very complementary. And I think that's really powerful that is actually, I find that I'm actually being asked more questions on a regular basis by conventional colleagues than naturopathic colleagues on a regular basis. It's really cool to see that transformation. I never thought in my lifetime that would ever be the case. And so it's super exciting to be part of this right now.
What kind of questions are they asking you?
First of all, they're really intrigued by why my patients do better. So first of all, I'll get a few calls. They're like, why? Okay, so this person shouldn't be here. So a really good example was just a couple weeks ago. I had a patient who we were getting her ready for a very aggressive surgery for her bladder cancer. She had 8 tumors that had gone deep into the musculature of her bladder. She'd been on her own trying to treat it naturally for a while. So by the time she came to me, it had gotten pretty aggressive. Luckily, I have a very good relationship with one of the head. Well, he's actually the chief medical officer at Baylor, but he's also the a urological oncologist, and I consulted with him, and he was very open to working with us integratively. So getting her ready for the surgery, I did kind of our standard naturopathic surgical prep, things like modified citrus pectin and vitamin C and zinc and all our typical go-tos. But I also started her on mistletoe therapy, just subcutaneous, just to bolster her immune system, get her ready while she went into this treatment. And remember, bladder cancers are often very immunogenic. We use a vaccine typically to treat it. And she was not a candidate. I can't recall right now why, but she was not a candidate for that vaccine. But we still knew it had an immunogenic component. So in the 3 weeks that we were starting her on mistletoe before she went to MD Anderson to have this very aggressive surgery, in fact, they thought she'd be without her bladder at the end of it, he got in there. And of those 8 tumors, there were 2. And they were just peeled right off the wall. None of us expected that. None of us expected that. And it was sort of like a, what? And she'd had multiple she'd had full-on CTs, PET scans, cystoscopies, the whole gamut. This was not a misdiagnosis. And so just in the interim of prepping her for this, something happened. We turned her immune system back on, and her body started to take over. They were going to start her on systemic treatment. He did the surgery. He basically said, okay, you don't have to do this anymore. This man is now pouring through the literature and looking at starting a trial there specific to injecting, not just subcutaneous, but injecting right into the tumors of bladder, which has been there's a lot of studies and a lot of outcome studies around the world on that already. But that's just an example where it was a shock for all of us. But most want to know why our patients simply feel better and are still having good response and have less recurrence rates and have less multiple drug resistance processes happening and have longer progression-free survival. They're just getting curious now. They're not just seeing one every once in a while. They're seeing a collection of them. And that is where I'm not changing it. You're not changing it. The patients are changing it. And the patients are starting to demand that their doctors collaborate with their entire healthcare tribe.
And this is where skeptics, put their hands to their ears and they say n equals 1, n equals 1, n equals 1, and it doesn't matter. Where's the double-blind placebo-controlled trial? And to that I say, well, that person didn't lose their bladder, and I really don't care if this is a double-blind placebo-controlled trial. What I care is that we did the best for the patient, without obstructing, the gold standard of care or whatever you want to call it. It's complementary.
Absolutely. And he got in there thinking he was going to be in there for like a 6 to 10 hour surgery. An hour and a half later, he's out of there. The family, they were actually shocked when he came out to the waiting room. They thought she died, because they were told, be ready for like a long haul. So that was kind of we can laugh about that story now, but you're right, there is. And you know what? So what about the n equals 1? Because guess what? We are all an n equals 1. There is no standard of care for cancer. I know we keep trying to put it in that, but there's no one reason we got it and no one way to get us out of it.
And that's what pisses me off about when it comes to research and science, and because there's people that use science as a battering club just to make themselves feel better. I don't know, a lot of the stuff that I do is in vitro, and if they just took a moment and studied the scientific method and they understood that research starts with a hypothesis and ends, basically with a meta-analysis. And everything in between is just to get closer to that meta-analysis. Someone has to do the in vitro experiments. And all of this is applicable. Case studies, n equals 1, double-blind placebo-controlled trials. And on the other side of the spectrum, we have to look at the highest quality data. We have to look at who sponsored the trial, and sometimes, not because big pharma sponsored the trial, that means that's just bullshit research. We have to take all the evidence and make the best decision for our patients.
Right. And the thing is I'm that person who I can think outside the box. I can just use some kind of critical thinking abilities to go, well, that mechanism makes sense. Why not apply it to this? I mean, that's how I seriously tried that on myself for all of those years, and had my biggest breakthrough only. I mean, my body really seemed to quiet down and really stop actively cancering only about 10 years ago. Right. So 26 years in this process, I was still really bouncing around because frankly, I was still learning. I was my own N equals one. I was my own living laboratory. I was my own cell line study trying to figure this out as I went along. And each time I learned something new within myself, I'd apply it to a patient, or I'd learn something with a patient and I'd apply it to myself. It has evolved into something that was an N equals one. And now in my world, it's just the way it is. Right. And so I get tired of people wanting me to sort of prove it to them and show them the data. I'm like, the data is sitting across from me on a couch, or the data is bawling their eyes out that 1.5 hour versus 10-hour surgery was a shock and surprise for all. Like, I don't need to wait for the trials to help my patients feel better now in whatever time they have on this planet.
And I think it has to do with like approval of drugs, and maybe there's a little bit of fear that if we do this complementary natural therapies, that maybe the patient will forego proven therapies. Like for example, testicular cancer. The safest thing to do is to remove the testicle. And if maybe we are a little bit scared that people are going to try to treat themselves. You started your conversation with this same patient that tried to treat herself, and unfortunately she wasn't doing it right. But that's why education is so important, and that's why there needs to be a stepwise approach to cancer. And that's the reason I wanted to have you in the show, because the paleo diet made me, superhuman. I used to be, chubby and not a lot of energy. And I started doing paleo or ancestral, whatever you want to call it. And now I'm a doctor, and I always wanted to be a doctor. And it helped me in so many different aspects of my life. But there are people that are finding about this therapies and diet and health that are here because they had the worst news of their lives when they were told you have cancer. So at that point, what should a patient that has never heard about naturopathic medicine, that thinks a patient that thinks that doctors are for your annual physical so you can get a discount on your insurance company, when they receive those news, what should a patient do?
So this is such a good question. And I wish that this could be just screamed out into the universe to change where we start with this process. Because frankly, the most dangerous part of a cancer diagnosis is the diagnosis. Okay. That shock, that trauma of those words being served to you is that moment. And the way you respond to that moment is often very telling of how this story is going to end. Our reaction to that information is very telling of how someone is going to respond to any therapy they choose. And so for most people, it puts them into a state of shock, fear, trauma. Now, for some, it's short-lived, and it's a invitation and a catalyst to get them moving and get them empowered. And for others, it paralyzes them and it leaves them completely disempowered and just throwing over all of their care to somebody else blindly. So my first comment to someone is just that this diagnosis itself is the worst part of this journey. The second piece of information is take a moment and breathe. Okay. There are very, very few exceptions where cancer is an actual emergency that needs to be dealt with. I mean, if someone's landing in the hospital because they have a bowel obstruction because a tumor is pinching off their bowel, of course, you're going to start going down treatment right then and there. But if you are finding something and it's not causing any harmful emergency situations, you do not have to jump right into that lake, if you will, and start splashing around like crazy. You have time to take a breath, to take a moment, to get very clear, and to listen very intently on what that cancer is trying to tell you, because it is you. and it's yelling at you loud and clear. It's been whispering to you for a long time, and then maybe shouting, and then maybe screaming bloody murder, and now it's got your attention. Because none of us go to bed one night. Just like you said earlier, I went to bed and I woke up and I'm a doctor. It didn't happen that way, right? Just like it doesn't happen with cancer. It took you how many years of pre-med prep, and it took you how many years of actual medical school and all the, the flaming hoops you jumped through of board exams to stand where you are right now. It's exactly with the cancer process. On average, 8 to 10 years that cancer has been brewing in your body. And so to make a decision in an hour, a day, a week, a month, 3 months on how you're going to approach this is very dangerous if you just jump in out of that initial fear, terror place. That doesn't often end well. So that is the most important piece, because no matter what the choice of treatment is, you have got to get your head on straight and you've got to explore the why. So if I'm lucky enough to see somebody right at the beginning of their diagnosis before they've started into any treatment, I start to test. We want to know, where is their terrain right now in this moment before you start confounding it with tons of chemicals and radiation and surgical interventions that are clearly poisonous and toxic to the body, as they're meant to be. But I want to know the baseline if I'm lucky enough to have that. That's where I also, if we had a biopsy, I want to make sure that person sent it off for tissue assay from molecular profiling. If there's a validated test method for their liquid biopsy, I want to look at their general laboratory function. I want to look at their metabolic functioning. I want to see what's going on with their blood sugar. I want to look at tumor growth factors such as TGF beta, insulin growth factor. I want to look at the whole gamut, because in my world, there are 10 main patterns that drive cancer, or that are patterns that are part of a cancering process. Things along the lines of our epigenetics, our microbiome, inflammation, glycemic control, hormonal balance, stress hormone and circadian response, angiogenesis, circulatory issues. I know I'm missing a few. Mental, emotional, obviously a big one here. Those are just a few that I'm going through. So when I'm looking at the labs, I'm thinking in terms of these terrain 10 concepts. And then I can help the patient say, hey, look at this. These are the priorities. Right now, it seems that your hormones and your blood sugar are the biggest places where we should start. And remember, because we're a whole organism, if you start to tug on any part of that body, if you start to address any of it, you're going to impact the whole. So even if I have a patient just dive headfirst into one of those terrain 10 imbalances, they're going to have a positive impact everywhere. But that's a way that we can sort of assess the whole terrain and know what is their biggest problem. So for instance, if their blood sugars are very high and their insulin is high, guess what? Most of your therapies are not going to work. Radiation is completely rendered useless because sugar and insulin desensitizes the cancer cells. PARP inhibitors, useless. Aromatase inhibitors, useless. Most chemotherapeutics, useless. So if you're going to pour all this harm in there, wouldn't it be great to help make those therapies work much better by lowering the glycemic load and the insulin response so that those therapies can get in and do their job well? That's just one example.
Or as simple as, if you lose a little bit of weight, if you do decide to go with chemotherapy, now you have to use a lower dose.
Right. Yeah, right? And so then, of course, we hear the doctors telling our patients, eat anything you want, but just don't lose weight. I mean, seriously, that is a death sentence. That is the worst information ever. Somewhere along the way, no one taught them the understanding of metabolic muscle wasting, the cachectic process versus just losing weight. And so we can actually assess that through simple laboratory. If the protein and the albumin and the creatinine and the calcium are all drop into low ranges, then you're dealing with some metabolic muscle wasting. But if you're simply losing weight and those values are still in a good zone, you're just dealing with weight that needed to go away and stop being the toxic sponge that it's been for this person's body for all these years.
Toxic sponge, and let me add, inflammatory toxic sponge.
Thank you. Exactly. They bounce right off each other, don't they?
Okay, and so what would you say to someone that, maybe, they're 45, 50, smokers that never cared about their health? They go to the doctor and now they have something that is, suspicious in their lung. How do you because that could be the bifurcation in the road where they wake up and they say, okay, I'm going to start juicing and I'm going to change and quitting smoking or whatever. But it's hard to do, and that's going to be a very small fraction of our patients. When you are diagnosed, what are some of like the best return on investment habits that you can incorporate today to help you with your diagnosis?
Well, as naturopaths, it's so easy just to go right away to our determinants of health, right? And so the basics. Most people on the planet today, I mean, it always chokes me up a little bit. I get a bit emotional when I think about it. Most people on the planet today are not, they're not living in accordance with nature. They don't have access to clean air, clean water, clean food. They don't even know that they're being poisoned on every single bite of food they take or every sip of water they take. And so first of all, just start to be aware of your surroundings and start to just simply get to know your local farmer, rancher, farmer's market. Visit your little, I mean, heck, there's an entire organic section at Walmart these days. There's no excuse now. I mean, you can go and find organic food in Dodge City, Kansas, the area where I grew up, which wasn't there a few years ago. Looking at the Environmental Working Group's website and start to assess what is in your drinking water. At the very least, get a Brita. It doesn't do much, but at least it's better. It's a step up from where you are. There's 7 known carcinogens in my city's drinking water, right? 26 suspected. Come on, guys. I mean, these are what is around us. We are all living and breathing in a toxic soup these days. And so I want to bring people education to realize, small steps, drinking a little bit of quality filtered water, cleaning up, at least avoiding the dirty dozen, is a starting point for the people who this is so new for. But really, a couple of the basics, and they go right back to nature cure. Get in accordance with the cycles of the day and the cycles of the seasons. Get outside. I don't care where you live, how cold it is. Get outside at first sunlight and let your face meet the sun. Even if it's cloudy, even if it's snowing, you're still getting this stimulation to your pineal gland, to your pituitary, that is telling your body, flooding it with information that says, hey, great, we're starting the day off right. You're putting us on track. You're restoring our rhythm. And then when it gets to be the sunset time, put on your orange goggles, use your eFlex covers on your computers, no screen time whatsoever after a certain period of time. Unplug your Wi-Fi, make sure there's no EMFs in your room, black out your room, keep your room a bit chilly. When you go to bed, those simple things, even Rob Wolf, your guru, he's playing with this stuff in his own chemistry right now, saying how profound those basic day-to-day cycles are in restoring rhythm and function of your cells. It's free.
And if you boil it down, all of the things that you said affect the mitochondria.
Exactly. That's exactly it. And so again, we go down to this. What do we call, so you know what the mitochondria are in naturopathic medicine? The vital force, people. It's prana in Ayurveda, it's chi in Chinese medicine. It moves me so much. It's like these little guys, I've always been searching in Western medicine of like, how do we relate our vitalistic ideologies? These little mother organelles, these little factories of power and energy, they are our vital force.
Yeah, you can call it vital force, chi, prana, the force, whatever you want to call it. If you take care of those little powerhouses of the cell, then you're gonna be in a good place. So basically, I'm gonna distill all of this that you said into one in one phrase that I love. Don't let perfection be the enemy of good. As in, you can't afford to eat completely organic. Get the dirty dozen. If you can't buy at a farmer's market, try to shop at the organic section of Walmart. And if you can't afford that, try to shop in the regular section of produce at Walmart.
Yeah, exactly.
Don't let perfection be the enemy of good. So this morning, driving to work, I'm listening to NPR, and they had a story about addiction. In the story, this person lost his son to an overdose. And they had done everything. They had sent him to the best treatment centers for abuse, and he had started college. And then he said, and this is like a complimentary sentence or saying to don't let perfection be the enemy of good. He said, don't let hope get in the way of reality. And how profound is this? Because, like, for example, we're talking about all this cool, amazing things that we can do, okay? But sometimes we can let hope cloud our reality. Sometimes you do have to do some things that are going to be bad for you in the forms of treatments, chemotherapy, radiation. Maybe you have already been treated and then you learn about naturopathic medicine, and now maybe you're sad, but let's not let hope get in the way of reality. We have to have a balance, a yin and a yang. Okay, so during treatment, how can you help your patients fight off the effects of all of these things that sometimes we have to do?
Well, that is another beautiful question. And one of the coolest facets of integrative naturopathic oncology right now is how much we have learned as naturopathic oncologists of the therapies that we offer in our toolbox to, like to support the effects of chemos and radiations and whatnot, and augment, like help offset side effects and enhance overall, the rest of the healthy cells at the same time. So we have a million different tools. Depending on the treatment, we can overlay a very elegant nutraceutical, supplemental, dietary lifestyle plan that makes that conventional treatment hum. That's how I tell my patients, like, we're gonna like kind of crystallize your treatment into something. We're gonna upgrade it. Okay. The other cool thing I've had patients do is set their own intention. So I have patients who come in, into the room, and they actually bring, I have one client who made these fun little covers for her chemo bag that she made them into like glitter, and she wrote words like love and healing and grace and gratitude and joy all over this bag, just like we've seen in that, the water, where you can change the crystallization of the water with thought. And so she was putting that over her IV bag, and I started sharing her story with my patients. And I think all my patients do that now. Even if they would take a Sharpie and write love or gratitude right on the bag, as it's going in, things like that. Or even simply we're using some peppermint oil on their abdomen or on the soles of their feet. There's something very nurturing about that. And it feels like I'm doing something along with this. Or a heating pad over the tumor in the midst of getting the chemotherapy is a very powerful way to drive the treatment deeper into the tumor. And then the other thing we can do to supercharge, enhance the response to the therapy, as well as mitigate the side effects, is simply fasting around these therapies. Again, free, right? And so work like, and if you're terrified of doing it with just plain old water or plain old water and bone broth and herbal teas, then you have people like Dr. Longo out there who has his Prolon medical fasting mimicking diet program that you could take around this, so you feel like you're still eating something, but it's still creating that fasting mimicking effect, which has got loads of research showing that it enhances the treatment for the cancer exponentially.
So, I'm fasting right now. It's about 24 hours right now. And you know why I'm fasting? When I started work, we have a shorter day on Fridays, and the office closes at 3. And I would bring my lunch, and then you get so busy, patient after patient after patient, and then I wouldn't have time to eat. And then I'm like, oh man, I didn't eat today. And I would go to the fridge and grab my lunch and take it home, okay? And then I sat down at home and I was like, Megan, I didn't eat today again, so busy. And then I was like, hey, I'm fasting. That's good.
Yeah, switch the mindset.
So now I have fasting Fridays. So Friday, it's a celebration of fasting. So I don't take lunch. I'm making it into hey, today is my fasting day, and I'm gonna have dinner, but it's gonna be about 24 hours once a week, and I'm fighting cancer. I'm making it an achievement instead of like this thing that happened to me that I was so sad about because I was so busy and I couldn't eat. So it's just switching your mind, your frame of mind can be so powerful.
So powerful. And our early predecessors of naturopathic medicine were big into water fasting. And we didn't have the science back then to go, oh, what that's doing is the autophagy, and it's bringing up new mitochondria and cleaning up. We now have the science to tell us what people have been doing for millennia, right? Like naturally. And I love that again, the reframing of the context. So like the patient covering that bag and making it, she then started calling it her healing juice, right? And other people call it like their mojo. Like you change that framework around it, and it totally changes it. So I think that is a critical piece. And the other thing is, I really want my patients to let their doctors know that they're doing an integrative approach. And so I give my patients, it's actually part of my book, but I have questions for them to take to their oncologist, and I want them to interview their oncologist to say, you don't have to know this or even give me your blessing, but I want you to be okay with knowing that you are just one part of my medical team. And I might have my nutritionist and my naturopathic oncologist and my body worker and my, shamanic, whatever,
And my
my
friends and my
my
family.
exactly all of this, my dog, whatever it is. And if a doctor says, no problem, I don't get it, I don't understand it, I don't really believe in it, but yeah, I'm game, that right there is a great response. But I'll tell you, 99% of the time, the doctors, when the patient just comes at them saying, you are part of my tribe. Can I have, will you be willing to be part of that? It changes the energy there instead of just hiding it and running around pretending you don't have this happening on the sidelines, or coming in saying, I've got this other person and they're telling me, like, you're not being confrontational. So if you're inviting your team into your inner circle to support your health, there is something that also energetically shifts within you, because you are now in the center of this. You are truly the patient centered process, and you're not a tumor, you're not a number, you're not hiding from each other what's going on, and you are so much more powerful with a tribe around you.
And that is so interesting, because isn't that like the future of medicine?
So the future of medicine, and it's now, it's just trickling a little bit slowly, like a mycelium running around the earth.
Like mycelium. Oh, speaking of mycelium, okay, let's talk about mycelium. What are your go-to mushrooms for people with cancer?
Ooh, there's so many good ones. I mean, if I'm working with somebody with like melanoma, I'll of course use like chaga because of the betulinic acid. If I'm working with like ovarian, we've got a lot of studies on agaricus with that, and I see a lot of really powerful support there. Of course, the typical like the Ganodermas, the reishi, like those are just these kind of general supports. I've seen some really amazing stuff with turkey tail, some of the extracts, the HCC, and some of the Coriolis. I mean, you're seeing some really, the PSK of the Coriolis, you're seeing some pretty cool stuff from the extracts, as well as the whole. I want people to get the whole creature, not just the extract. But I'll mix them up, and I tell people, just in nature, when we forage for mushrooms, it's not like we were like, oh, I'm going to only eat button mushrooms, or I'm only going to eat Ganoderma, or I'm only going to eat, we were mixing it up. So I still have my patients rotate through, but I might come in specifically if I'm trying to, say, raise white blood count, or I'm trying to, help have a true anti-cancer effect, or just different modalities. I'll use different mushrooms at different times.
Did you listen to Stamets on Joe Rogan?
Yes. So good. Yeah. Like, his book is one of my favorites. I see the way he sees mycelium, like the way he sees that kingdom is how I see the body and how I see cancer. That's how our brains are very simpatico.
I had the opportunity to meet Paul Stamets at A&P back
Was it a
in.
couple years? I met him. Yeah, a couple
Yeah,
years.
yeah, yeah. Yeah, that was my first time presenting in that at A&P, and that was out in Oakland.
Yeah, that was Oakland.
Yeah,
Yeah.
that was Oakland, and then and I keep in the back of my head, he's such a fun guy, and then he pops up on Joe Rogan. I know that guy.
So fun. And he comes over the hill from us a lot, almost every year, to the Mushroom Festival in Telluride. So I've seen him there a few times in a pretty intimate environment, and just a groovy, he is one with these beings.
Yeah, he's an
Yeah. Cool.
yeah. So for anyone out there, you haven't listened to that 3-hour interview, you should really sit down and just like go into the
Great road
matrix.
trip.
Yeah.
Yeah, seriously good. I love it.
So we talked about what happens before, we talked about all the different options that you have. So, we can use botanical medicine, we can use acupuncture, we can use massage, we can use water fasting, diet, to mitigate everything from like decreasing white blood cell count to your cachexia, nausea, pain. All of those things can be, while you are in treatment. And I want to finish the show in a good note, because the people that treat cancer are my superheroes. It takes a really special person to go into that world, and I don't want this conversation to sound like we hate oncologists. Those guys,
Not at all, right? Not at all. We need
yeah, we need them. It's just that their training is very specific, but we need their training in order to be the most effective that we can be. And we need naturopaths, and we need massage therapists, and we need acupuncturists, and we need friends, family, spirituality, whatever you want it to be. Okay. So before you have to go in and get your own team, how can we prevent this from happening?
In one of the dialogues on this forum that I was telling you very beginning of the show, where I was kind of being kind of bludgeoned with science, a scientist earlier, that was exactly this conversation. Is someone started saying, they were basically quoting the Vogelstein studies that's come out in the last couple of years, saying cancer is just simply bad luck. There's nothing you can do about it. And I try, and I'm just watching it. I'm like an observer on this breast cancer forum, and I can't hold my tongue. Okay. I can't hold my tongue because they're saying, oh, and it's, because we have 50% of the population likely to have cancer now, it's because it's a disease of age. I'm hearing, frankly, all the bullshit mythologies around it. And my liver starts, I start to get activated. Looking at the lens, starting to come out to play. And I just got right into the conversation to say, you know what? We are not powerless. We be a shoe to drop. Just because 1,600 of us are dying every day from this disease, just because 1 in 2 men and 1 in 2.4 women will have cancer in their lifetime in this country, does not mean we have to be that statistic. So, that being said, one of the first things patients will always say to me, Guillermo, is, I was healthy until I had cancer. And so of course, they learn very quickly after they go through the assessment with me that they weren't, right? So what I try and do is, first of all, I like to have their whole family, friends, anybody on the talk, because then it starts to inspire other people to realize, holy cow, there is so much more that I could be looking at and thinking about and observing and learning about, so that I can really know what's going on in me and really not be sitting here next to my mom or doing what my mom's going through. So that being said, is I'm always, like, in the beginning of my book, I have a questionnaire. There's 10 questions under each section of the Terrain 10 that people need to ask themselves. And that's a good way of starting to do just self audits. Like, what am I being exposed to in my life, in my diet, in my water, in my air, in my maybe my medications or my annual flu shot or my work environment, whatever it is. Folks just don't know. They just don't know until they know. Right? So trying to educate is key. So asking themselves, doing a simple audit, a simple questionnaire is a really good place to start. And then they can go, yeah, it looks like I could work a little bit on this area, and that'd be great. That's one way, right? But the other way is to start to just listen to your body, lean into your body. Take a look at your day-to-day life. Do you feel good when you get out of bed in the morning? Do you feel like you're ready to meet the day? If you don't, if you're fatigued, the number one sign, the first sign of mitochondrial dysfunction, of mitochondrial insufficiency, is fatigue. We're all walking around fatigued today because our poor little mitochondria are screaming for some help. Help take the garbage out. Help induce some good healing for that. The little bits that you're like, I love your fasting Fridays. Start to implement a little bit of intermittent fasting. Even the simple 8, that 16-8 option twice a week, right there is just going to give little tiny tune-ups and little house cleanings to your body on a regular basis. End your showers in cold. Start your day, like I said, greeting the sun.
Why is that? Why do you end up your showers on cold?
So that you've now vasodilated everything in that
With
nice
the warm
shower, right? So you're like, oh yeah, we're in that. And then when you put it on cold, you squeeze those vessels. You're like wringing out a sponge. Okay. And then when you get out, so you're squeezing all that around, you're pumping the lymphatics. And then when you get out into the room temperature and you dry off, everything comes back to homeostasis and has a little more tone and a little more responsiveness. I don't feel complete if I don't finish my shower in cold these days. I've been doing it for so long now. And the first few times people do it, they're a little resistant, but once they get into it, they're like, holy cow, this is awesome. And so it becomes like a little bit of an addiction, there. But these are these moments that you can just start to look at how in sync you are with your body, the season, the hours of the day. Those are simple things because we are so far from being in sync with ourselves and the world around us. And those are some places that I mean, the Nobel Prize this year in science was given to scientists in circadian rhythm. The year before, it was for autophagy. Okay. And so, what we're talking about on your podcast right now are the two biggest, hottest areas of research in science. And these are things we can do for free every single day.
And not long ago, it was an Artemisinin.
Thank you.
Yeah,
Exactly.
yeah.
Exactly. Oh, in 2012 or 13? Exactly. And yeah.
If you have been diagnosed, it's not the end of the world. It didn't happen overnight. You should not expect it to be cured overnight, and you should use all of your resources that you can get a hold of and do really a team effort. And not everyone is going to react the same way. For some people, it's going to be the catalyst that is going to change their world and their life and touch a bunch of people. And so, unfortunately, some other people, it's going to just put them down and put them down.
Yeah. And sometimes that's okay too. It's not a failure. We look at death as a failure, and it isn't. We all are going to get there eventually, right?
There's a book, I think it's called Dying with Grace or something like that. I just recently read about that. And I tell my patients that I've met, people with cancer that are healthier, like people with active cancer that are healthier than people with no sign of disease.
Absolutely. I see that every day. Every day.
Because they are grateful, and it's like a sobering, like there is something that happens when you're standing at the edge of the abyss that makes you realize how lucky we are. And sometimes, and you'd mentioned that, like people don't know what feeling healthy is, just like people don't know what feeling hungry is. Like right now, I haven't eaten for almost 24 hours, and I am not hypoglycemic. I have hunger, but it's like exciting and it's like motivating, and like my stomach is growling, so I'm releasing ghrelin. I don't want to just curl up in the corner and wait for someone to bring me glucose tabs. And that's the difference, that's the difference, that we can take cancer and we can make it, we can fight it and accept it and beat it, or we can make it the end of everything. And we can say that about anything, and don't get lost in your diagnosis, and don't get lost in your own head. We hear about orthorexia and being so sick that you're scared of eating anything that is unhealthy, and we should be more resilient than that.
Yeah. And it's interesting when you something that you said that struck me that I feel like I should articulate is one of the reasons why I also didn't tell people about my diagnosis for so long and about my processes. Well, I think part of it, first of all, is, I wasn't quote unquote by Western standards cured.
You're still not.
Right. And so that always felt like kind of weird to just have this conversation. But mostly why I didn't is because I did not associate myself as a cancer patient, as somebody, I'm someone who happens to have cancer in my body. That's how I see myself. And I think that's why I'm so effective with my patients, because that's how I see them. And I try and encourage them not to be a cancer patient. And that seems to make a big difference in their process as well.
Pretty crazy conversation. We went to all realms of oncology. Any final words for people that are listening to the show that maybe know someone with cancer? Any words of encouragement? What would you tell your friends and family? Like, if you were looking back, what would you want them to hear?
Yeah, or what would I have liked someone to tell me when I was in that moment? Well, first of all, and I don't mean this as a shameless plug for my book, but I'm going to say this because I wish I had me 25 years ago, because that's what I wrote this about. This is about being a roadmap back out of those dark places. So that book is a really good starting point for people to understand how they got here and where they can go. So it's all about empowerment. But the other book that I think is very, very powerful that I would recommend they pick up is Radical Remission by Kelly Turner, who was a researcher who started hearing more and more about these spontaneous remissions, right? And she started doing research. In fact, she tracked down 10,000 quote unquote spontaneous remissions, and researched them all, and then created this book of the 9 common factors of why those folks are still here. And what you'll notice of those 9 factors, all but 2 are on the psycho emotional spiritual realm. So that book is very, very powerful. She actually has a website now and still continues to catalog and collect these. And she doesn't call them spontaneous because she calls them radical remission, because they're not like someone's just sitting around on a couch picking their nose and saying, oh, cancer's gone. They are taking massive life overhaul steps to change that. I was no different than these radical remissions. I've been one of her radical remission stories. September of 2016, I finally shared my story with the world on her website. The scariest thing I have ever done. I say it and I almost want to cry just saying that, because so vulnerable. I held that for so long, and to put it out there was very frightening. And so in knowing that, there is so much more that you can be doing to both prevent, support the body during the time, and to clean up the body after. Because I actually tell patients the real work doesn't start until the chemo, radiation / surgery, targeted therapies, whatever, are done. Because that's get in, get out. That's like the cytoreduction phase of it. That is the teeniest sliver of what needed to happen for that body to fully recover, because 70% of people who've had cancer will have it again if they don't take that bigger, broader support. And so that is so powerful to me, that we have so much that we can do to not be those statistics. It's an exciting time to be part of integrative oncology.
So she basically recorded 10,000 n equals 1.
Yeah.
But they're all n equals 1, so there's no value.
I cannot believe how many people out there on the internet are like, oh, that that Kelly Turner researcher, she's hooey. I'm thinking, for the love of God. So some people just don't want to see it, right?
Yeah.
You can never convince. So, you can hear those. I hear those voices all the time out there. They are loud and they are mighty and they are many. But you don't need their voices. You just need yours, and you just need your own inner spirit and your own inner light. And then you will find others that celebrate that within you. And then it will just start to percolate and grow from that. Instead of growing a tumor, you'll grow a network of love and support around you.
That was beautifully said. So, where can people find you? Are you taking patients? Where can they buy the book? What are your handles on the interwebs?
Oh God, I love first of all. So I love the handles. I'm finally understanding what that even means, because that's just not my generation. But you can find me, Dr. Nasha Winters. So Dr. Nasha is one word, Winters, on Facebook. Also Optimal Terrain Consulting on Facebook, and the Metabolic Approach to Cancer book on Facebook. So those are all the different places. My co-author, Jess Higgins Kelly, her company is Remission Nutrition. And then, of course, you can find information on her through the Metabolic Approach website as well. Today, I don't have a brick and mortar practice anymore, so I do consulting. I take that bird's eye view. I do the testing, assessing, and addressing, and I help place you exactly in the places you need to be to get your treatments done. And so I do see clients now. OptimalTerrainConsulting.com is my website. And then you can also get the book through all your favorite book vendors. It is now, we found out today, by the fall of 2018, it will be translated into Korean, German, and Spanish.
That's awesome.
So I'm psyched. We just it's been out for 6 months. It's now hit over 10,000. We've hit #1 multiple times on all Amazon sales. What makes me happy, why I'm sharing this news, is because people need and want this information. They are looking for it. They are seeking it. And surprisingly enough, we are not getting many haters from it. So it's been a pretty cool journey to see. And I am thrilled and honored to be able to share my personal story and that of thousands, if not tens of thousands of patients that I've helped along this way with all of you.
Well, there's going to be a lot of links on the show notes for this podcast. This is a very personal subject for me, and I do get emotional just talking about it. And it's amazing, and I'm so glad to finally have someone that specializes in cancer and talk about, because it seems pretty gloomy out there, and when we talk about it, and to have like this beacon of light, that there is. There is a chance, there is hope. It's just so important to me personally, because I chose not to do cancer for a reason. It's just too personal, you know. And I'm just so glad to have people in my profession that I can call my friends that are doing this hero's work. So your hero's journey is not over.
It's just getting started.
It's just getting started. Yeah, that's why you didn't have one, because you haven't completed it. It's
exactly.
Yeah.
Exactly. You can tell the story after I'm gone. And I'll be very old, by the way.
Yeah, you're very, very old. You know, you'll be another N=1 for longevity.
I'm planning on it. I'm working on it. Yay.
Well, thank you so much for coming on the show. I hope to see you soon at a conference. Are you going to any conferences, any talks, anything like that?
I am. In fact, on Wednesday, I fly to the Acres Conference, which is a huge biodynamic agriculture farming, or organic conference, which is so funny that I'm going to be a keynote speaker there. So it's really cool that our message is getting into big ag and like, really, where does this come from? It comes to the basics of our livelihood, food. So I'm feeling like, oh my God, there's like a revolution happening even at that level. And then there's a ton of really cool metabolic conferences in the spring and summer. I'll be also speaking in Europe a lot next year on mistletoe and hyperthermia, and also the TerrainTM concepts and a lot of different conferences there. And I'm helping on a lot of research trials right now. So there's some amazing stuff coming up this year. So follow me, see what I'm up to.
And let me know, anytime you have something that you need, pumped out, I'm sure my listeners would love to know what you're doing and what you're up to.
Right on. Thank you for that.
Dr. Nasha Winters, thank you so much. And I'll be seeing you soon somewhere, I'm pretty sure.
I know it, my friend. I'm counting on it because you are an amazing human being. So thank you for this.
Talk to you soon.